everyone. In this session, I'm going to take a very important topic from disaster management, that is triage. So, I will let you know what is triage sieve, what is triage sort, what are the types of the triage, what is the color coding system, the most important in the triage system. Then we will see the tagging. So, let's start it. So, here you can see we are starting triage. So, what is triage? In case of disaster, first of all, what is disaster? Disaster is a catastrophe in which at least more than 30 people are injured or dead simultaneously. So that is the definition of the disaster. You can see disaster can be a volcano, can be an earthquake, can be an accident, can be anything in which more than 30 people are injured simultaneously. It can be a mass casualty at a time. Now, being a medical personnel, being a medical healthcare provider, this can be a panic situation. So preparedness is better. So we should know what are the steps to be followed and how to manage this panic situation in which the mass casualties can be brought to the hospital. What are the steps to be followed? So one of the steps is tried. So this is the disaster management cycle. In the disaster management cycle, there is a separate video. You should watch that also. I assume you have watched that video. So in the disaster impact, there is triage. We do the triage. So basically what we are doing, we are classifying the injured people on the basis of severity of their injury and on the likelihood of their survival. We are classifying them in 4 categories: the red, yellow, green and black. So all the injured people are in front of you. There are multiple casualties are there, multiple people. So triage is done on the field itself. So someone, the healthcare provider, should reach the field at the earliest and do the triage. Now we have limited resources, limited manpower, limited doctors, limited OTs, limited medicines, everything is limited. But the mass casualties are there. To whom to treat first? It is not first come first serve basis. No, it is not that. So we treat them based on their severity of their injury and based on their likelihood of survival. So based on that, we do the triage and we classify them, which is ultra urgent, which is urgent, which is not very urgent. We classify them. It is not the basis first come first serve. This principle is not followed in this situation. It is not the one who is coming first in the hospital, we start treating them first. No, it is not. It is not followed in emergency. Triage give best result when carried out at the site of the disaster. At the site of the disaster only, just classify them according to their category and then shift them to the hospital. Triage sieve is very quick procedure. Separate the dead and the walking from the injured. We cannot do for the dead anything. They are already dead. And the walking one, ask them to go. Okay, so we have to separate the injured. We want to work on the injured. So first do a sieve. Sieve means we are separating the injured from the dead and the walking. It should be a very quick survey. Now from the injured, we will do the sorting. We will do the sorting and allot them in 4 categories. So first do the sieve, then do the sort. In the sieve, separate the dead and the walking from the injured. Now the injured, we have to sort it again. We have to sort it again based on their severity of injury and likelihood of survival. So the basis is severity of injury and likelihood of survival. We classify them in 4 colors: the red, yellow, green and black. So you can see the red is the highest priority. They require immediate resuscitation or some limb or life-saving surgery within the next 6 hours. In the next 6 hours, if we treat them, there is a likelihood they will survive. They require urgent care. The yellow is high priority. They are not urgent, they are not highest, but they are high. In the next 24 hours also, if we attend them, it's good. So possible resuscitation or lifetime saving surgery, but within the next 24 hours, it will work, right? The green, the next is the green, it's low priority. They have minor injuries. And the black, they are already dead and moribund. They are already dead. So the black one. So you can see on the site itself, you have to see the walking of the person, the breathing of the person, the respiratory rate of the person and the circulation of the person. Based on that, decide the category. Decide the category and give them a coding, which color code they follow. So we will do tagging for that. How to give the color code? Just suppose there are mass casualties in front of me and I am there, the healthcare provider, the personnel, and I am doing the triage there. I am doing the triage. So I am looking for all the respiration, circulation, walking in all of the persons, and I am dividing them in one of the 4 categories. First I have done the sieve. I have separated the dead and the walking. Now the injured one I am doing the sorting and dividing them in 4 categories. So where I will write which patient is in which category. So for that the cards are available. These type of cards are available. On these cards we have to write their color code. Of course, one of the 4 color code: the red, yellow, green and black. One of the 4 color code we have to write with their identification if it's possible, the age, the place of origin and their category, in which of the category they are following. And these cards we will put on their wrist or in their neck with their identification and shift them to the hospital. Now there are 2 types of triage, simple and rapid. What do you mean by simple? In simple triage, in case of mass casualty, on the site we are just segregating them and shifting them to the hospital, nearest hospital, and in the hospital we will give the treatment, right? In case of mass casualty, we do so. In order to sort the patient, those need critical care, we do it on the site and then we shift them. So this step is required before transportation becomes available. Once the transportation is available, we will shift them to the hospital and remaining procedure can be continued in the corridor of the hospital only before taking them inside. Rapid triage, here what is rapid triage principle? It's START. What is the full form of the START? It's simple triage and rapid treatment. So simple, we are segregating them and giving them rapid treatment on the site of the disaster itself. Sometimes it's very emergency, and this emergency treatment can be given by light trained laymen also, or emergency personnel people. It is not the thing to instruct the medical personnel or supervene that. So it only serves as an instructive example. So someone present on the site of the disaster and being a medical personnel from distant on telephone, you are instructing that do this on the injured person, do this. So even a lightly trained layman person can do so, and by doing so we can save lives. So this is rapid triage. Sometimes reverse triage is followed. Normally in triage, the person who is having more injuries are given first priority, the less injuries given less priority. But in reverse triage, the person having less injury is given more priority. When it is done, there is an exception. When it is done, so sometimes the less injured wounded persons are treated in preference to the more injured. Example, in wars, in military, there is a soldier who has less wound as compared to another person who is not a soldier. So we will give priority to the soldier because once they will be back, they will go back for the fighting now. So in case of military settings where soldiers can be returned to combat as quickly as possible, we want to make them return or combat as soon as possible. So that is reverse triage. So you can get a question on the simple triage, rapid triage, reverse triage, learn the types of the triage. So we are done. I guess you understand the 4 categories, the color coding of the triage: red, yellow, green and the black. The red one is the highest priority. We have to treat them within 6 hours and that can be a life-saving surgery. Yellow, the high priority but not the highest. Within next 24 hours also they can be attained. The green, they are the low priority and they can go, and they have very minor injuries. And the black one are the dead, the moribund, right? So we will solve some MCQs now. The first question is in front of you. As per the most common classification of triage, that is internationally accepted, the color code that indicate high priority treatment or the transfer. So can you tell me, is it black, yellow, red or blue? What is the correct answer? Yes, red. The high priority. High means they are asking for highest. The next question, black color in triage indicate what? Is it death, transfer, high priority or low priority? We all know black means death or moribund. So the next question is triage category correctly matched. Tell me among the following which of them is correct. Red indicates dead or diseased. Is it correct? Black indicates minor injury. Is it correct? Green indicate immediate intervention needed. Is it correct? Or yellow indicates stable patient need observation. Is it correct? So I guess everyone can understand. Red is not dead. Red is the highest priority. Black is not minor injury. Black is dead. Green is minor injuries. Green is the minor injuries. It's not immediate intervention. Yellow is stable patient need observation only. Right? So that is the thing. So in the university exam, you usually get a question on complete triage. Here you have to write the definition, you have to write the sieve, triage sorting, you have to write the color coding, the ultra important, you have to draw the 4 colors, and color coding you have to explain, and the types, the 3 types, the simple, rapid and reverse triage. Color coding they can ask you separately, tagging they can ask you separately, in which the cards are made, in which we write the triage. If they are giving a question on tagging, write down triage also. So, and if they are asking triage, you have to write the tagging also. Both are interconnected. So first we classify them, categorize them, and then we put it on the card. Putting it on the card, putting the details on the card is known as tagging. So that's all about it. I hope you got it. I hope you understood this topic with crystal clear concepts. Now, if you want the notes of this topic and all my YouTube session notes, then you can click on the link which is pinned in the comment box. Thank you so much for your kind attention, for your patience, for your valuable time. Now, here a QR code is provided to you. You can scan it if you wish, and via scanning it, you can connect with me on various social media platforms like Instagram, Telegram, WhatsApp, where I share educational content which will be very useful for you. So if you wish, you can take the snapshot or you can scan it directly. And here is the contact number provided to you. You can save this contact number. It's 98330 32948. This is for WhatsApp support, chat support. It is not for calling. So if you have any doubt in the topic which I'm teaching you in this session, and if you have any doubt in other topics also in pathology, pharmacology, microbiology, PSM, medicine, you can text your query here. And if you have any topic in your mind and you want me to take that topic, to schedule that topic in YouTube, so you can also text that topic here. So if many students are demanding the same topic, we will schedule it soon. So thank you so much. Wishing you all the best. Bye-bye.